Niño and her colleagues from Kurima village in rural Mudzi gather once a week to prepare porridge for their children. Each one of them brings whatever produce they have in their house. Maize meal, millets, ground baby fruits, peanut butter, milk and leafy green vegetables are all mixed into a porridge that has enough nutrients to feed these children. Due to poor harvest experienced last season, stocks are running dry, and most of these and other ingredients are running out as well.
She says, "This is a drought year. We donate what we have in our different houses, and we bring it together and cook together. Previously, we used to prepare this meal on a daily basis, but now we are forced to reduce to 2 times a week or even once a week. Most have run out of food in their houses. That's why we can't continue to cook daily."
More than 500,000 children under the age of 5 in Zimbabwe are at a risk of severe malnutrition. Health authorities have recorded spikes in severe and moderate acute malnutrition cases in the past 3 months, and there are growing fears that the situation is only going to get worse.
In March, we had around 73 children who were admitted into the moderate malnutrition program. However, in June, this figure had rose almost by 50%. Now there are around 126 children who are malnourished, we now have moderate to malnourished whom we had to admit. For the severe malnutrition program, we recorded a decline in terms of the ones who are severely malnourished from around 60 to around 41 in June. This has been attributed to the mitigatory measures which the government, as well as partners with support from UNICEF.
The Zimbabwean government and UNICEF are implementing 2 key initiatives to curb malnutrition cases. These are the school feeding programs and community-based feeding programs. Initial results point to success in the initiatives.
This has seen an improvement in our infant and young child feeding indicators, as well as building mothers' efficacy in terms of doing nutritious feeding to children. This has also intensified screening for malnutrition. So we've seen more numbers of children being screened for malnutrition. So early identification as well as treatment before malnutrition gets severe. At the moment, we do in Mudzi, we've only been implementing in 5 wards this approach out of the 18 wards. So we do look forward to scaling it up to make sure that we don't miss the other children who are in the wards that we are currently not supporting.
UNICEF has appealed for $84 million to help fund such initiatives. The UN has identified up to 12 countries in the SADC region where some 1.1 million children under the age of 5 face severe acute malnutrition. Khumalo, SABC News.